Welcome to the segment on trigger point massage for the scalp and the eyes and the face. This is a technique that should be included daily in your trigger point massage routine, but it is also very useful for relieving eye stress and eye tension, eye strain from looking at computers all day long, or for dealing with headache pain. So I have separated that from the rest of the trigger point material so that it can be used standalone. For this particular exercise, the only thing you'll need is a hairbrush with these kinds of bristles. There are certain hairbrushes out there that have really, really fine bristles, and they will produce quite a bit of pressure on the scalp and on the face. So we want this to be fairly blunt. And this is the best kind to use. It's a very simple one, very inexpensive. This is just an Estee Lauder. You can get them almost anywhere. They're very, very easy to find and very inexpensive. So for the first part of this exercise, if you're wearing your glasses, just take them off. And you're just going to take the hairbrush and essentially just massage your scalp up and down, back and forth. It works really easily if your hair is short. If your hair is longer, then be very, very careful, very gentle, so that you don't rip the hair out at the roots. But you'll be able to get a fairly good scalp massage very easily just by moving the brush around. You can go up and down, back and forth, any way you essentially like, around in circles. The objective is simply to massage the scalp. And remember that for people who suffer from headaches, it is mostly the scalp that is involved in the production of the headache pain. So this will help to relieve or even to reduce the incidence of headaches if you make this a part of your daily routine. So once you're finished with that, the next part of the exercise is simply to take the brush again, and you'll want to just massage gently the forehead. You can get down around the eyebrows, alongside. You can even massage the cheeks. Just a very simple massage of the skin. This stimulates the skin. And prepares everything for the deeper trigger point massage that we will be doing in just a moment. You can also use this brush to give yourself an overall skin massage. You know, it's very gentle on the skin, and it just provides a simple massage-like pressure that helps to stimulate the skin and the nerves in the skin, brings blood to the skin, and it's just a simple way of being nice to yourself. Once you're done with the scalp massage and the facial massage that way, you'll want to move on to the actual trigger points. And there are several that can lead to pain either here in the eyes or in the head itself, headache pain, or here in the temporomandibular joint. Even toothaches can be caused by muscular tension in the trigger points. So the next thing you'll want to do is just begin up here, and you'll just want to massage around here. And if you find a trigger point, then you'll just sort of want to spend some time on it. Right here at the temples is a classic place for trigger point tension. And you'll be able to feel it because it will actually hurt as you press into it. So if you find a spot like that, remember that in order to get it to release, press directly into it and just hold that pressure with as much pain as you can tolerate. The basic rule of thumb is to apply enough pressure to the trigger point so that on a scale of 0 to 10, where 0 is no pain and 10 is very intense, almost unbearable pain, the pressure will produce a pain of about a 6 or a 7, and hold that for about 60 seconds. And then you can just continue all the way down. You'll find the trigger points. They can be here. They can be here. You'll be able to feel it right there, right next to the ears, and then just all the way down along the cheeks. We'll get to the temporomandibular joint and the sternocleidomastoid muscles in just a second, but we want to make certain that we pay a special attention to our eyes. And there are a number of different points, like right here, just on the supraorbital ridge, right here next to the nose, and just right beneath there. This is a classic point for trigger point tension. So if you have some, you'll be able to tell, and just apply pressure right there and follow the same basic rule. And then if you just move it over just a bit, there may be another trigger point right there. And then further a little bit more over here, all the way down the ridge. There'll come a point here, about right here, where you start to feel pressure on the eyeball itself. So just stop right there. You can come all the way around here, and that's just applying pressure to the trigger points against the bone. All the way around. Another trigger point is right here at the top of the nasal bone. You can locate here at the cheeks. This is typically another trigger point. Just find it and then just press. Move further out on the cheekbone. As you move out here, you're going to get close to the temporomandibular joint, and pretty soon you'll probably find some tender points. And just apply the pressure for about 60 seconds. All the way out to the ears. You'll be able to feel any tension right there. Move down. Remember that the trigger points can be as small as the head of an eraser on a pencil. So you might find several trigger points along these particular muscles. Right here, you can see that it's right underneath the jaw. Right here, you can feel it. Feel it right there. It's right underneath the jawbone right there. And so once you've completed the scalp massage and all of the trigger point massage for the face, then you can move to the sternocleidomastoid, which is right here. It's that big, strong muscle that moves right from here and inserts down here next to the collarbone. You can actually move your thumb right into that hollow. Be careful because that's very close to your vocal cord, but you'll be able to do it if you're gentle and careful. And then just massage. Massage all the way up. And this is, again, a very, very typical spot for tension in trigger points, all the way up to the insertion here, right behind the ear and at the jawbone. And then do the other side. Remember to take your time. Remember to hold the pressure for about 60 seconds or so. The recommendation is to do that 11 times a day if there is a definite trigger point that you encounter. And if you perform that 11 times a day, holding the pressure at a level of 6 or 7 pain-wise, and hold it for 60 seconds, and do that 11 times a day, that will facilitate the release of the trigger point in about 2 weeks or so.